Julia George.
BBC Radio Kent.
In fact, let's stay with that right now. Taking a look at two parts of Kent. The life expectancy in Tunbridge Wells, right over in the west, is 87. In Cliftonville, in Margate, 72. 15 years less. Chief Medical Officer Professor Chris Whitty has told the BBC that seaside towns need to change to address the balance. He's been speaking to my colleague Natalie Graham.
So you can have excellent regeneration, and each one of these towns is a remarkable place to live and a beautiful place to visit. They are really wonderful places, but alongside the beautiful areas on the coastline and some of the resort areas, very close to them, you can often have areas of really significant deprivation, houses of multiple occupation, and quite limited ability of people to get to both work and indeed to healthcare.
A lot of these things are so huge, aren't they? Transport connections, education, they're pretty difficult problems for governments to resolve. One solution I noticed in your report was that if you can encourage young people in coastal towns to go into the healthcare profession, that's a kind of double win. How do you achieve that?
Well, I think there are two things we should be doing on that. The quickest win, in a sense, is to have more people doing their training in medicine and nursing in coastal towns or near them, because people tend to settle and bring up their families where they train. That's true for many trades. It's certainly true for healthcare. And then the longer term one is strongly to encourage people at school, at college, in coastal areas to have aspirations to move to work in healthcare, social care, and the other caring professions. You can do it. Why not be a doctor? Why not be a nurse?
Let's talk about the pandemic. I know you were working on this report before COVID. Do you think the pandemic will bring these issues higher up the agenda at Whitehall, or do you think there's a danger that it'll be harder to implement some of these changes because everybody's distracted, understandably, by COVID?
Well, I think what people should realise is that last year in particular, many of the resort towns took a real hit because of lockdown. Some of them have recovered some of the ground because of people doing staycations more recently. But in the long term, that's not going to solve the problems of these beautiful towns. You've also got the port towns, the previous fishing towns. So with many of the towns around the coast, what they have is they were centred around a single industry, whether it's fishing, tourism or ports in particular. And then that industry has changed and the town has been left in a sense designed for a previous form of employment. And one of the things we need to do with all of them is take a long-term view about how we recreate a sense of the excitement that you had along the coast when these towns were first produced. If you look at, for example, reports from 100 years ago from Margate, they were expanding because they were so economically successful. And what we ought to be doing is looking at all of these and trying to work out how we can reinvent them for the next era. As
chief medical officers go, you have the highest profile. You're a national figure now. Do you hope you can use your own personal profile to bring about change in coastal communities?
I think that the people who are best at advocating for change and designing the change are people in those communities. I will do my best to support them, but I think we need to win it on the arguments.
Right, let's talk to somebody in one of those communities. That was Professor Chris Whitty, of course, our Chief Medical Officer, speaking to Natalie. Karen Constantine's with me now, Labour Councillor for Newington on Thanet Council and a County Councillor for Ramsgate. Hi Karen, how are you?
I'm no longer a councillor for Newington, though. I'm a county councillor, and that covers Newington, just for clarity.
My apologies. We'll make sure that we don't make that mistake again. Karen, is there this inequality that Chris Whitty was talking about there with Natalie, even within different parts of Thanet?
Yes, and I'm so pleased that we've had this report, and I'm really grateful to Professor Chris Whitty for bringing this, raising this up on the national agenda. Really, it is a marked difference in places. My 7 wards in Ramsgate, I've got some wards that are really poor. Poor health is very visible because you can see people that are very disabled one way or another. And then in other areas, you've got people that are thriving, they've got businesses, they've perhaps moved down from other parts of the country and they're doing really well. And interestingly, they're making a lot of use of the local amenities, lots of sea swimming, lots of walking, etc. So actually one part of the community is really taking steps to improve their own health and mental health, and other parts of the community are really left behind. And I think what's interesting for us is that point about GPs. The GP ratio in Thanet is really high. So it's something like, in some parts of Thanet, it's 1 GP to 7,000 people. So how on earth are you ever going to get an appointment? And that's comes through repeatedly for me. People unable to get dental care, to get appointments.
Karen, you were just making the point, we were talking about GPs and ratios. And of course, Chris Whitty has talked about the idea of trying to get people in seaside towns to train up in the medical profession. We have got a new medical school here in Kent, albeit not right down where you are. Is that going to make a difference?
I think it should do in the long term, but in the short term, it's going to be very difficult. In a place where you've got poor education, poor educational opportunities, you're not getting the young people to a standard where they're ready to aspire to go into clinical professions. And often in clinical professions, you need to get your A-levels in order to get to university. And unless you're a grammar school pupil, you've passed the Kent test in Thanet, you've got to go to Canterbury to do your A-levels. So it's just barrier after barrier.
Well, so hang on a second. You cannot sit A-levels in any sixth forms or sixth form colleges on Thanet?
Unless you're in the grammar school stream at 11, or unless you get into that grammar school stream at 16, you have to travel to Canterbury.
So I just want to be really clear that I understand this. The non-selective schools in Thanet don't have sixth forms?
They have sixth forms, there's colleges, but they don't do the A-level subjects. You've got to go to the BTEC. So you've got to go elsewhere to do your A-levels.
So if you wanted to take... So let's look at what are the traditional medicine subjects. You would be doing 3 sciences or maybe maths and 2 sciences.
You'd be doing maths, biology, physics, something like that, yeah.
OK.
And you'd have to go to Canterbury. And I've been contacted in the past 24 hours by a young woman that's going to Canterbury to college, but doesn't have a computer, doesn't have a smartphone or an iPad or anything. So that's one of the things that we've been doing during COVID is providing hardware for people. But this is an endemic problem. These are the situations that just don't go away. And you can't keep putting sticky plasters over these individual situations, hoping that you'll come up with a systemic solution. So whilst ever we don't address kind of crippling poverty, we're going to be trapped in this situation.
Yeah. And there's poverty and there's poverty of aspiration as well, isn't there? Which are we talking about here? I
think we're talking about both. So because I think if you've got poverty and you're not getting, it's difficult to, you've got to pay to go to Canterbury, there's extra costs involved, etc. for those young people wanting to do A-levels. If you don't have those nurses and doctors amongst your own community, you don't know how to enter into the profession, you don't know what the routes are, you haven't got the support, you haven't got the role models. So it's a kind of, a spiral that's moving in the wrong direction. So, we need a proper sort of task force to look at this. We need to look at the things that we're currently doing, like cutting universal credit. I think that's just going to make some of the very poorest, most vulnerable families and young people.
Yeah, but come on, everybody knows that Labour doesn't have an answer to how to keep paying that extra money. And it's such a cheap shot, isn't it, from Labour politicians over and over again to say you have to keep the uplift. But at some unknown point in the future, we'll stop using this phrase about the people with the broader shoulders, and we'll actually tell you how we would pay for that.
But isn't it about invest to save? Isn't it about taking a more long-term view? Isn't it about saying that we need to harness and appreciate the talents and abilities and skills of all our people, and not just accept that these poorer communities, particularly coastal communities, just get left behind? Because the cost of patching people up when they can't get access to GPs and operations, the cost of dealing with mental health issues when they become critical or acute is much more expensive than paying people families £20 a week so that they can eat properly. Because with the best one in the world, you're not going to avoid poverty if you don't have access to food or you're choosing between eating and heating.
Are people genuinely making those choices, and will be making those choices in your community this winter?
Yes. Some of our people have got such hard lives. And the other thing I want to say about that, when you talk about aspiration and making choices and parents and grandparents, etc., guiding their young people, when you're living hand to mouth like that, life is chaotic. It is chaotic. It is difficult. You are going to several supermarkets to get your food. You are fighting for every scrap. You're travelling to the food bank. You're fighting to get your GP appointments, etc. And life gets really chaotic. And that takes away, potential to give time and guidance to young person. So it makes life very hard for people. Being on universal credit and being in food poverty it's no means an easy option.
But we also need to remember that a lot of people on universal credit are in work, aren't they? So isn't there really a bigger question about making work more profitable in the first place?
We agree. I've always thought that, and I think it's ridiculous. We've got workers in large supermarkets where, where they're making vast profits and have always made vast profits, and the taxpayer is in effect subsidising those wages. That is completely wrong. But, we need to have a proper look at coastal communities. It's not right that people...
But isn't this it? I mean, Professor Chris Whitty has had a proper look at it. But
now
what has to happen now?
Solutions in place. We need to put the solutions in place. So we need a task force, And one of the things I would ask for, so for instance, I sit on the Health Overview and Scrutiny Committee at Kent.
Yes.
Is I would ask for a yearly set of metrics where we benchmark very clearly in very simple graphs what's the life expectancy, what's the infant mortality, which is another key indicator. I mean, for life expectancy to be a huge gap is one thing. For life expectancy to beginning to stall and fall is quite a different thing.
But isn't the reality with lots of people moving out to the coastal towns, because the COVID has pushed, and the work from home has pushed people out, that there might be a slight sort of uptick because people who are healthier, have more money, have the better opportunity to look after themselves, not because of any merit of their own, just because of their circumstances, are moving to these places. Are we going to start seeing people saying, well, actually, look, the average life expectancy is going up, when in reality, some people are going to be really struggling still?
The people that tend to move out to the seaside communities, and Chris Whitty referenced this, are slightly older people, perhaps either retiring or approaching retirement, and their medical needs, their clinical needs are higher. You've got that U-shaped health need, haven't you? When you're first born, your health needs are very high, and then it comes down. You've got the U-shape, and as you get older, it goes back up into the other side of the U-shape. So it's more costly, etc. So it could be that some of the people coming into the towns are actually unwittingly they're going to, create a further burden on the services. But when you've got a shortage of GPs like that, when you can't recruit GPs into the area, you're just stoking up a fire. It's why people are calling 111. It's why they're going into A&E. Yeah. People with health needs aren't getting them met. So sometimes the problems that they're dealing with become more difficult to deal with. So it's just the wrong way of doing it. We need to have a look at how we improve the health of coastal communities. And I really think that a lot of that is based on the avoidance of poverty. I mean, some of my wards now, 51% child poverty. Those young people are being born into poverty and they're never going to escape it. And part of poverty is really poor health. So kids at 13 and 14 becoming actually really sick and ill, and then actually not being able to access the services that will really help them to improve. And the other thing is, I think we've got, we've got this mental health crisis. I think we really need to look at what we're doing with regard to mental health, because I think there are, across Europe, I think there are better models of helping people to get well, rather than just kind of simple strategies around CBT. It's one of the things I've been looking at recently. So I think there's much more we can do, but we need to change how we do it. We need to adopt the best practice from across Europe, and we need to finance that properly. And we need to look at it in terms of what we will save in the long run, not what we're spending in the short term.
Karen, thank you so much. I'd love to talk in more detail, and perhaps there's an appropriate time coming up about your work on the mental health crisis and what you've seen in other countries. So let's see if we can book you in to talk about that in the future. For now, thank you so much. Karen Constantine, Labour Councillor for the County Council for Ramsgate. This is BBC Radio Kent. The time is 12:32.